Can you give suggestions on self-care toe and foot massages for foot or toe pain? There's a couple of different things that you can do. And when we're looking at self-care, I'm going to show you a model foot. When you look at a foot, the bones all kind of run long into your toes, and you've got these spaces in between. Now, sometimes just from use of and wear and tear of your foot, those bones can kind of squish together and they can kind of round out, and you can get these weird forces on them where the muscles in between the bones get sore and knotted up and tight, and that's really where you want to focus. The other place is at the bottom of the heel, and you can see this is actually your plantar fascia. And so it attaches into that heel bone, and it runs along your foot and it helps create that arch. So if you're having heel pain, which is very common, this is going to be an area where you want to work as well. So I'm going to show you a couple of different techniques for doing that, so that way you can try working on your own feet. If your hands are in good shape, this is going to be really good for you. If your hands are not in as good a shape, try and have a partner use these same techniques to help loosen up your feet. Couple high-tech equipment things. One is a spoon. And this is your ordinary soup spoon, and this can be super helpful. I'm going to show you kind of on my foot so you can kind of see. You can use lotion, any kind of lotion that you like is fine. It doesn't tend to matter exactly what type, as long as it's something that you like the feel and smell of. And where you're gonna work on your foot is you're gonna try to move those bones apart. Remember, I said they tend to tighten up. So what you wanna do is actually pull in between each of those bones on your foot. If you kind of pull apart, that helps. Now with your spoon, what you can do is on the bottom of your foot, go along in the direction of those bones, and you're going to use the back side of that spoon. So you've got that edge that you can kind of push down with, and that will kind of give you some leverage to work through there. Now if it's not too ticklish, it actually feels really good. Now if you notice, like we're not going this way. You're not trying to scoop the skin off your foot. You want it to be that back side. Now you can also do that heel, that spot where on the model there was the red part. Now you can take your spoon and do kind of like a circular motion, and that actually tends to feel really good. So you're just pushing kind of down on that heel, doing like a C shape or a circular motion around it and getting into that foot. Another thing you can do is pull out on your toe. We call it distraction. It helps to relax and loosen up those joints. I'm not trying to pull my toe off. I'm just trying to give some nice tension, compression through each of those toes. And that kind of helps loosen up and relax those foot muscles. Now you can do the same thing on the top of the foot in between the bones as you do on the bottom. You can either use your fingers and go through here. You can use your spoon and go through there too. Now positioning wise, it's always easiest to kind of work in this position in terms of moving down. It's harder to be able to see what you're doing. And so you might have to make some adjustments in terms of your position and how it's going to work best for you depending on what hip mobility you have, knee mobility, and a lot of times you can even just feel with your fingers, even without being able to see what you're doing, to work within in between those bones. Fingers, use your spoon, massage cream, biofreeze. Topicals work really well on feet because there's not a lot of tissue over the top, so it's easier for them to soak in. So biofreeze is something we use at the clinic here. If you have a different type, whether it's something with CBD or arnica, those tend to be good. doTERRA has a great deep blue that I really like as well. So whatever you like and tend to use, that would be a good option for you. A couple other things that you can do. One is my ever favorite lacrosse ball. And so you can put it on the floor and you're just gonna roll your foot right over the top of it. Now you're not trying to like step on it while you roll. You can control how much pressure you have, and that works really well on top of that plantar fascia in terms of spreading that out and getting that moving, because once again we want to spread those bones out in your foot. That can work really well. The other thing, which is another cheap option, is you take your water bottle and you put it in the freezer, and once it's frozen, you then you can use it for your foot as well. And that gives you some nice ice cold treatment to go along with the massage work. And then lastly, once you've kind of worked in between the bones, you feel like your muscles are relaxed, your heel is feeling better, then when you go to stand up on it, really try and stand up and spread your foot. So try and think about spreading those toes out, so then when you do put weight on it, that you're getting some of that space in that foot that you want. And that tends to really help with things feeling better, particularly if you're getting pain in your toes. The only caution I would give you is if you happen to have what's called a neuroma, and this would be something that if your doctor, your podiatrist has looked at it and said that you have one, that is not an area you want to work on top of. So if you happen to have a neuroma, you're going to stay away from that spot. And that tends to be kind of like a pea-sized spot. It's not a big part of your foot. And work around it, but don't work right over top of it.